All right, and as we make our way down onto our backs, just take your time. No need to rush. Have your Pilates ball kind of handy and nearby. And then give that give that nervous system of yours a second just to settle into the ground beneath you. Let your tailbone figure its way, let your shoulder blades figure themselves out, and then let your body have just a moment before you do anything, just to have a breath. And then, although it may be small and simple, but because we threw something in new just by putting that space between the toes to get started, take the time, let your feet have that extra moment, wiggle your toes or just soften into the ground beneath you. And then take the time to come up to your jaw and notice if you're holding any tension in your jaw. And you're going to see if you can just ask your jaw to soften 10%. And then once you've softened your jaw, just about 10%, we're going to do some head turns. And I want you to think like when we do I Dream of Genie Arms and the head goes in the opposite direction of the elbows, you're going to do head turns and you're going to move your jaw in the opposite direction of your head turn. So as you turn your head to the left, wiggle your jaw a little to the right. And as you turn your head to the right, wiggle your jaw a little to the left. Take one or two more times from side to side, or just even yourself out. And then when you're ready, bring your head back to center and little micro nod of the head up and down. Like you're not trying to close off the front of the neck and the throat. You're trying to do that little maneuver where you roll the ball of your head or the occipital ridge of your head slightly upward towards the top end of your mat. So just a little gentle nod of the head up and down, not going to extreme. Nice. One more little nod of the head up and down, and then keep that length in the back of your neck. So roll the ball of your head so that the occipital ridge is kind of reaching towards the top end of your mat, but there's still space in front of your neck and your throat. You could talk and your vocal sound would be normal. So take a second just to find that little bit of length in the back of your neck. And then float your arms up into I Dream of Genie arms, but keep your rib cage anchored down towards the ground and keep that nice length in the back of your neck. And holding those slightly firmer positions, it might reduce the range of motion of the elbows pulling from side to side, but stick with keeping your rib cage anchored down and a little bit of length in the back of your neck. All right, now you're going to loosen everything up so everything can come along for the ride if it wants to. And you're just going to take elbow taps from side to side. So you maybe are rolling a little across the rib cage, letting the shoulder lift, maybe even your hips move with you a little bit. So find just that fluid motion so your elbows can tap on the right side of your mat and then the elbows can tap on the left. Take one more elbow tap from side to side or even yourself out. And then as you come to center, you're just going to take a second to readjust. So we're going to work up on the right side. So you're going to think where approximately where your right side front protruding hip bones are. You're going to come a little bit to the inside of the abdomen. And I like to hold down just a little bit so that I can get just a sort of a smooth glide of my hand. So you're going to be working on the right side, and you're just going to do about 10 glides of your hand. Like you're just trying to massage into the soft tissue of your abdomen. Really what we're doing is working the digestive tract. So you're just going to do about 10 glides up on the right side. And then once you've done about 10, you're going to take it over and across from right to left. So at the top, underneath the rib cage, in the soft tissue of your abdomen. And again, I like to pin it just so that I'm not dragging my clothes and all the skin and connective tissue along. So I want that little bit of massaging into the digestive tract. So pinch and hold in a way that makes good sense if that works good for you. And then just drag from right to left across the top. And you're going to do about 10 there. And then once you've done about 10 there, now you're going to maybe pinch and hold at the top on the left, and we're going down on the left. So you're going to be up and under the rib cage and then down towards that hip bone or toward the inside of the hip bone. So again, we're just working that digestive tract. So we go up on the right, over and across to the left, and then down on the left. And then once you've done about 10 good ones on the left, then grab your Pilates ball. And now we're going to push in with the Pilates ball and just follow that track. So we lighten up across the bottom just so that we're not pushing too hard. And then we push up on the right, over and across to the left, and then down on the left. And then once you've done about 10 or so there, take a second to just let the weight of the ball rest, let's say right on top of the belly button. And then your hands are just going to stack on top of that ball. And we're just going to encourage a little bit of softness in the abdominal muscles. So reduce effort in your abdomen as much as you can. And then we're going to take a couple of slow, deep, intentional breaths into the rib cage. And you want to think 360 breath in the rib cage, like you're trying to move the bones of your ribs front to back, side to side. So we get that nice expansion into the bony structure and that nice stretch into the intercostal muscles. And with each exhalation, you almost want to think soft belly, let the air go, which means the ball is going to slightly come down towards the spine just a little bit, as long as you can encourage that softness in the abdomen. Do what feels comfortable. Just because I'm saying these things does not necessarily mean it shows up in your body. So if you get here and it's causing any pain points, lighten up. If it's causing any tension in your jaw, lighten up. Take about 5 more cycles of breath if you can. Once you've completed those cycles of breath, we're going to take that Pilates ball and we're going to put it between the knees or the inner thighs. So move it on down so it's in that space between the knees, and think of it more like a gentle space saver or space holder. And then walk your heels in so they're roughly close to your butt, prepping for that hip bridge position. Once you've got that ball in place and your feet where you want them to be, take it into pelvic tilt. As you exhale, press your low back into the ground. And then as you inhale, release to the natural curve of your back. Exhale, press your low back down. Inhale, release to the natural curve. Exhale, press. Inhale, release. And now for these last 3, see if you can reduce any effort coming from your legs or your butt and make the pelvic tilt happen a little bit more with the core muscles, abdominal muscles versus the core muscles and the butt muscles. So exhale, belly button to the spine, tilting the pelvis. Inhale, releasing to the natural curve of your back. And then once you've done those three with that reduction of leg and butt muscle effort, take a second just to readjust everything that you want to. We're going to go into some hip bridges here. So hands alongside the hips, palms facing down, press gently into the backs of your arms and anchor your shoulder heads into the ground beneath you. And then on your next exhalation, squeeze your butt muscles first and then lift your butt up into that hip bridge position. And then on an inhalation, lower down, but think just like a nice long lever. So you're just going to bring your butt back down carefully and nice and controlled. And then on your next exhale, squeeze your butt muscles first and then lift up into your hip bridge. Inhale, return nice and controlled. Exhale, squeeze butt muscles first, lift up into your bridge. Inhale, return. Exhale, squeeze butt muscles, lift up. Inhale, return. Last one here. Exhale, squeeze butt muscles first, lift up into your bridge. Inhale, return. Grab the ball, get it out of the way, right leg only. Do 3 half butterfly flaps. All right, now take your ball, stuff it right up underneath the side of that right hip, let it fall out into half butterfly position. And with that leg in half butterfly position, we're going to do a little curl. So you're going to bring your hands like you're almost as if you're trying to frame your hip bridge position legs. You're going to press belly button towards the spine. Exhale, a little curl up and hold for 3, 2, 1. Inhale, slow return. Exhale, curl up and hold 3, 2, 1. Inhale, return. Last one here, but go belly button down first. Curl up and hold 3, 2, 1. Inhale, return. Leg comes up, grab the ball, left leg only. 3 half butterfly flaps. All right, now take your Pilates ball and wedge it underneath the side of that left thigh. Let it fall out into that half butterfly, but hands are now going to frame that imaginary hip bridge position legs. And then once you've got your ball in place, on your next exhalation, curl up a little bit, hold 3, 2, 1. Inhale, slow return. Exhale, curl up, hold for 3, 2, 1. Inhale, return. Belly button first. Exhale, lift up, hold 3, 2, 1. Inhale, slow return. Left knee comes up, move that ball out of the way, and then walk your feet out nice and wide. Take it into some nice big windshield wipers, big generous movement of the legs. Now we're going to take one abdominal vacuum in this low position with our legs in that wide position and our feet in dorsiflex. But if you're not in the mood for abdominal vacuum, you can leave it off and you can either just keep your windshield wipers going or just choose to go into the postural work and then skip the breath hold. So when you're ready, knees are going to be up towards the ceiling, legs are a little bit wide, dorsiflex the feet so the heels are connected and the toes and the balls of the feet are lifted. Arms are going to come into mid Athena arms. So you're going to go about shoulder height. Palms facing up towards the ceiling, fingertips pointing in towards each other. And then we press out into that hula hoop of our arms. So you want to feel like as you press out, the back of your rib cage anchors down. You reach a little energy out into the elbows. You're airing out your armpits, and there's these wide, proud shoulders, nice lengthy back of your neck. Once you've got your way there, take an inhalation, big 360 breath, fill your rib cage up. Exhale, soft belly, let your air go. Inhale, big 360 breath, fill your rib cage up. Exhale, soft belly, let your air go. All right, last cycle of breath. We're going to inhale, big 360 breath. Exhale, 4, 3, 2, 1. Prepare, swallow, close off nose, mouth, and throat, or pinch your nose closed, keep your mouth closed, and then we take a fake inhalation. Don't let any air come in. Let the diaphragm suction up and hold breath for a moment. And then when you're ready, slow release of your air, slow lowering of your arms, slide your legs nice and long to the end of your mat, and then take your legs into some corpse rolls. Turn the toes in, turn the toes out. When we do those apneas, when we do those breath holds, if you've got like a big belly full of breakfast, those are not going to feel good. So that would be time when you would choose to skip it. They are good for regulating emotions. So it can be nice if you're feeling a little too high or a little too low. That can kind of bring you back into that equilibrium. It can be great for low back pain. It can be great for any just core abdominal work, and then that stretching of the fascia. But you always want to just make sure it suits your body for the day. Take 1 or 2 more corpse rolls, and then we're going to go into a little roll up. So grab your Pilates ball and you're going to grab it like you're trying to pull it apart. And you're going to pull it apart and inhale, take your arms up above your head, and then pull that Pilates ball apart. And as you exhale, lift from your sternum, roll your way up. And then just as you come up, take that ball, tuck it underneath the right bend of your knee, and then 10 knee presses. You're just going to press down, use the top of your thigh, get a little energy coming from the top of the knee. A little press and squish. Go for about 2 more there. And then when you're ready, pass that ball underneath the bend of your left knee. And then we're just pressing down. You want to press down top of the thigh, kneecap pressing down, but we're not trying to lock the knee out. We just want to feel like there's a little bit of strength coming from the top of the leg. All right, 1 more press down there, and then grab that ball out from underneath. And now you're just going to bring 1 leg in, and all we want to do is have room to get into the shoelaces of the foot. So you're going to take that ball and you're going to start to do the doorknob turn into the shoelaces of your foot. And you can go down towards the toes. And all we want to do is feel like we're kind of moving that superficial fascia, the skin and the connective tissue, and get a feeling of increased warmth in the top of the foot, a little bit of an increased blood flow. All right, and then we're going to let the leg come out into a little half butterfly situation. And now you're going to work to the inside. Think about those little bones on the inside of the ankle and just focus on that spot. But then we push down and we do that doorknob turn. So don't push too hard that you put your ankle in a compromised position. So keep it a little bit sturdy, but allow that just that nice activation of that top surface of your skin to come in. Okay, now you're going to find that inside of the ankle and you're going to do a little twist and a doorknob turn, and then you're just going to do a little wiggly movement of the foot, holding that little twisted position. It doesn't need to be extreme. We just want to feel like we're pinning it just a touch and then moving it within. And notice if you're holding any tension in your jaw, because sometimes it shows up when we're doing that footwork and you don't even realize it because you're so focused that all of a sudden you go, oh yeah, it's there. All right, take 1 more moment. And then when you're ready, release. Take a second, just give that foot a little twirl. Notice the warmth in your foot. And then we're going to take that work to the other foot. So find your shoelaces and then just work into it in any way that makes sense. Do that doorknob turn, push, twist, and then move on to a new spot. Take 1 more moment there. And then when you're ready, we're going to take it to the inside of the ankle. So turn your leg out, get that inside spot, and then just do that doorknob turn again. Nice. All right, now find a spot. Push, twist, hold that twisted position, and then move the foot just a little bit. And then notice if you picked up any tension in your jaw. All right, one more moment there. And then when you're ready, set that ball off to the side, leave it towards the front end of your mat because we'll use it again. When you feel ready, flip yourself around, find your tabletop position. And then as you come to all fours, we're going to move our hands just slightly forward of our shoulders. So a lot of times I'll go wrists underneath the shoulders, but today move them a little bit forward. And then once you've got them a little bit forward, get your toes curled under just enough. And then we're going to take the table and rock it forward and back. How far you go back is going to be like what feels good to your butt and your knees, what feels good to your toes. And then if it feels like you're getting a nice bit of movement forward and back, you're going to adjust your hands so they come forward just a touch more, so that as you go back, you feel your arms stretch out a little bit more. All right, now for these last three, you're going to coordinate it with the breath. So you're going to exhale slowly as you go back and inhale as you come forward. Cool. And then the next time you come up to your table, walk your hands in a little bit closer, maybe roughly underneath the shoulders, slightly forward. Once you've got your way there, we're going to keep the toes curled under. Drop your belly down so you come into that cow position. So there's a little lift of your chest, a little bit of an expansiveness, and almost think like wide, proud shoulders pull the yoga mat apart. So you get that openness, even though you're in that extension of the spine. Now keep that good extension of the spine and add a nod of the head. Slowly nod your head up and down. One more slow nod of the head up and down. And then we're going to keep our feet in dorsiflex position, but now come down elbows and forearms. And now we're going to take an abdominal vacuum here. Similar principles. Let's think about pressing down into the elbows, broaden your shoulders, get those wide, proud shoulders, that nice action of the elbows pressing down into the earth. Your head is in a neutral but lifted position. So we're not just letting it slack, looking between our knees, looking to the space between our forearms. Nice intentional work there. Get your fingers nice and spread on your mat. Feel that nice wide, proud shoulders, that nice strong upper body. Now take a big 360 breath, fill your rib cage up. And then as you exhale, think soft belly, let your air go. Inhale, 360 breath, fill the ribs. Slow exhale, get a little bit longer in your spine. All right, last breath here. Inhale, 360 breath. Exhale, 4, 3, 2, 1. Prepare, swallow, close off nose, mouth, and throat, or pinch your nose closed to keep your mouth closed. Take a fake inhalation. Don't let any air come in. Hold breath for a moment. And then when you're ready, slowly release that air. Bring yourself up. Keep the toes curled under. Bring yourself up just enough, and then walk your arms out to that puppy pose position. Let your heart soften down. Toes are going to stay curled under just to get that good dorsiflexion and that nice plantar fascia stretch. Take a nice big breath. All right, now you're going to keep that wide arm position. So you're going to keep the puppy pose position. But if your butt sunk back and your heart softened down, now we're going to lift it up again. So we're going to find that wide, proud shoulder, upper body position again. So imagine that you're kind of broadening the plate of armor across the back body. Now take a big breath. Now this time we're going to go 2 cycles of breath. You're going to let the forehead rest on the ground if it touches down comfortably. So if your forehead can touch down, let it. It's going to reduce a little bit of effort in the cervical spine. Now you're going to take a big 360 breath, fill your rib cage up. Exhale, create a little bit more length or proudness in the shoulders. Inhale, fill your ribs. Exhale, 4, 3, 2, 1. Close off nose, mouth, and throat. Take a fake inhalation. Don't let any air come in. Hold breath for a moment. And then when you're ready, release your air. Slowly walk yourself back up to your tabletop position. And as you come up to table, slide your right leg back with the toes curled under. Rock your foot forward and back. So sometimes we change the arm position, the body position, the back position so that you can feel that inner fascial stretch in those abdominal vacuums in different places. Like that one in particular, when we're in that puppy pose-like position, I can feel it a little bit more low in the back of the rib cage, that little fascial tug. So you just might find it shows up and has a little bit of sensation in different places when we adjust the arms and the placement of our body. All right, take one more rock forward and back. And then when you're ready, slide that leg in, switch it over to the other side with the toes curled under, rock it forward and back. One more rock forward and back. And then when you're ready, bring it in. We're going to come right up to a down dog. So get both sets of toes curled under. Use your exhalation, lift up into your down dog. But just as you find that shape of the dog, look forward, walk your feet towards your hands, come to a soft fold at the top of your mat. And then hopefully here your Pilates ball is maybe ish towards the front end of your mat. And if it's not there, grab it, bring it up towards you. Once you've got your weight to the front end of your mat, 3 half forward folds. As you inhale, lift and lengthen your spine. And as you exhale, soften back down. Inhale, half forward fold. Exhale, soften down. Inhale, half fold. Stay there. Walk your hands up to the creases of your hips. Press into those hip creases. Get a little bit lengthier. Tip forward just a touch. You shift the weight into the toes and the balls of the feet. Hold steady there. Take a nice big breath. When you're ready, bend your knees, push down strong into your feet, lift up into a standing position, and then give yourself a second. Get yourself all adjusted. We want that Pilates ball to come so that it can come right underneath our feet, and we're just going to give it a nice good roll forward and back. When we use the Pilates ball to do roll, it's a little bit more of the top surface of the skin, so it's not going to always feel like some sort of deep tissue massage, but sometimes less is more. Sometimes the skin needs that nice warming touch. The ball has a little bit of grip to it, so it wants to just gently move and stimulate the top surface. All right, now we're going to try to use this Pilates ball to get our toes into extension. So you're going to get your toes onto the ball. Now my ball is a little bit deflated, so I have to work a little bit into it to get my toes into extension, but get your toes into that extension position best you can. And then if there's room available, you're just going to do little toe presses as if you're trying to just squish just a little bit more into the ball using the press of your toes. Go for about 2 more toe presses if you're pressing. And then when you're ready, slow release, and then you're going to pass that ball over to the other foot. Same bit of work there. Just a nice soft roll through the bottom of the foot. Liz, if your ears were buzzing yesterday, I was looking at shoes looking at shoes for our wide toe spread and the long, lengthy hiking trails. And of course, the ones that were most top rated were the ugliest ones. And I was like, oh no. I can't live like that. All right, when you're ready, put your toes into extension onto the ball and then get it so it just feels like you're getting a nice stretch into the toes. And then if you can get that little bit of work going on, press the toes into the ball. Sound going wrong? Okay. I go for about 3 more toe presses if your toes are pressing. And then when you're ready, slow release of your foot from the ball. And then with both feet nice and solid on the ground, take a moment just to shift your weight into your toes and then shift your weight into your heels. Shift your weight into your toes. Shift into your heels. Shift into your toes, stay there, just get a little bit taller up through the crown of your head as if you're trying to roll the ball of your head upward towards the ceiling. Take a moment just to notice that length in your spine and that shift of the weight into the toes, and then keep that ball of your head rolling upward, shift the weight back into the heels, and then see if you can get that nice even distribution of weight evenly distributed between the balls of the feet and the heels. And then once you've got your way there, inhale, arms up. We're going to go Charlie's Angel Mudra. So interlace the fingers, pointers up. Now press down into your left foot and tip over to the right. Push your hip out just a little bit and take a nice big breath. On an inhale, slowly come through center. Now press down into your right foot, tip over to the left, and push your hip out to the right just a little bit. Nice. On your next inhalation, come up through center. Unlace the fingers, but keep your hands together. Thumbs are going to touch the back of the head. And then we're going to fold down, bring those prayer hands right down your center line. When your fingertips touch the ground, release and inhale to a half fold. Exhale to soften back down. Plant your palms, step back to a plank position, taking just a moment in that plank just to feel that good strength, mainly in our feet and our toes. So get those toes under, press back into your heels just a touch. Push the earth away from you. Gaze down between the space of your thumbs. Take a nice big breath. All right, knees are going to come softly down, and then we're going to lower gently down onto our belly. Slow, controlled lower as we come down. Once you've come down, T position with the arms into some back extensions. Get your toenails touching to the ground. We want to keep those toes nice and anchored on the ground. Inhale and lift your heart, lift your arms, lift your chin. Exhale and soften back down. Inhale to lift. Exhale to lower. Inhale, lift. Exhale to lower. Hands are going to come in alongside the shoulders. And now nice high cobras, as high as you feel good about going. Inhale, lift your heart. Think stretch the rubber band from the sternum to the chin. And then exhale, slow return. And then when you're ready, do it again. Inhale, lift your heart nice and high. Stretch from sternum to the chin. Slow return to the ground. One more just like that. Inhale, lift up nice and high. Exhale to lower down. Curl your toes under, power up to a plank or push into your knees and then come up in a way that makes good sense. But hold that plank for just a minute. Get those toes nice and active underneath you. Press back into your heels. Push the floor away from you. Look down at that space between your thumbs. Take a breath. Awesome. Knees are going to come down slowly, tabletop position. You're going to grab your Pilates ball and we're going to wedge it behind the knee pit. So you're going to get it into the back of your right knee so we get the hamstring work in just a touch. So you're going to wedge it in, give it a second, get it where you want it to be, hug that heel towards your butt, and then we're going to take a couple of fire hydrants here. If you like it better with that low elbow, that's the way I like my fire hydrants. Bring your opposite elbow down to the ground so you get that nice sturdy table, and then take that right leg and work it up and down, holding that ball in place. Slow, steady work. All right, now we're going to take that knee and draw it in 3 controlled articulated rotations. You're going to go slow and go as far and wide with that circle as you can comfortably go and be in good control of. And then once you've done about 3 in one direction, take 3 going in reverse. Beautiful. And then once you've done about 3 in reverse, then we're going to switch it up to the other side. So grab that ball, and now we're going to stuff it and wedge it into the pit of the left knee. Get it where you want it to be. And then once you've got the ball in place, choose your own adventure with how you make your table for your fire hydrants. And then we're just lifting that leg up and off to the side. Take your time, go nice and slow. When you're ready, take it into those controlled articulated rotations, drawing a big, gigantic circle, slow controlled movement, finding that end of your range of motion using good control. And then once you've done about 3 going in one direction, reverse, go the other way. Awesome. And then once you've done about 3 going in the other direction, bring it on down, grab that ball out from your pit of your knee, go big toes together, knees nice and wide, take it back. And if you want to, take your ball along with you so it'll come right underneath your head. So you're going to go back to that extended child's pose position and then put that ball right underneath your forehead and let everything rest for 3 cycles of breath. Once you've done about 3 cycles of breath, slowly bring your butt up and away from your heels. Spin your legs off to one side. We're going to come right side laying down. So we're going to take that ball and get up into that side of the rib cage, lats, serratus anterior kind of area. So get your ball, come into the side lying position, place that ball up underneath the armpit. And then I just kind of like to tuck my hand a little out of the way because we're just going to kind of roll forward and back. So we're rolling across that rib cage area, armpit area. I'm a little high right now, so I'm sort of in that lat and armpit area. Adjust so it feels good. We'll move a little up and down as we go along. All right, one more roll forward and back, and then move it down or move it up, just depending on where you landed. Move it a little bit in one direction and then come back to that roll. Nice. One more roll forward and back. And now you're going to go lowish end of the rib cage. You're going to get that ball so it's still on the side of your body underneath the rib cage. Let the bottom arm go nice and low. Let your head come down nice and low. Let your top arm reach up and over, and then possibly your top leg slides back. So you get a little bit of space into the hip and into the front pockets of your jeans. So get that up and overhead reach. And then once you've got a nice side body stretch, take a nice big breath. Beautiful. When you're ready, slowly come up. I'm going to flip myself around so I'm facing out to you. You flip yourself around in a way that makes good sense, but we're just going to work it into the other side. So think side of the rib cage, lats, armpit, rib cage area. Find a spot that you can land on. Get that bottom arm cleared out of the way, and then just a nice roll forward and back. One more roll forward and back, and then readjust just a little up or a little bit down. Find a new spot to land on, and then roll it forward and back. Wonderful. One more roll forward and back, and then we're moving it down, staying underneath the ribs, but moving underneath the ribs. Let the bottom hand come down, let your head lower, top hand reaches up and over, and then possibly that top leg slides back to give you a bit of space in that front pocket. And then once you've got that good bit of space through the side body, take a few nice big breaths. One more breath. And then when you're ready, slowly come up. Now we're going to take that ball and it's going to go behind upper back body, a little bit of core work, and then a little bit of nice soft roll. So you're going to get that ball so it comes, let's say, like low end of the rib cage, but you're going to keep your abdominal muscles a little bit solid. So you're already in that slightly curled up position. And then you're going to curl up just a touch more, almost as if you're trying to bring your back away from the ball, but it's still there, and slowly pump your arms. And as you slowly pump your arms, you're going to lift one knee up, and then slowly pump your arms and lower that leg back down, and then switch over to the other leg. Slowly pump your arms, lift your knee up, slowly pump your arms, return the leg down, switch sides. Slowly pump your arms, lift your knee up, slowly pump your arms, lower the leg, slowly pump your arms, lift your other leg up. Slowly pump the arms, lower down. We're going one more time through sturdiness, as if you're trying to keep lifted away from the ball. Pump your arms, lift your leg up. Pump your arms, lower down. Pump your arms, lift the other leg up. Pump your arms, lower it down. All right, now hands are going to come behind the head, and now we're going to pick up the butt and roll. And you're just going to roll up and down as far as feels good. For this one in particular, the ball does sometimes try to grip and grab your costume. So sometimes you just got to take a minute, reset, and then go back to it. So just know that if you get all caught up, give yourself a moment. It is the nature of the ball. It wants to grab and grip because that's the beauty of it. And it's sometimes really nice if you're ever just wanting to do camera off situation. It is really good to catch all that skin, and it'll just increase blood flow to the whole top surface of your body. All right, you're going to take a few more rolls up and down, and then we're going to go upper back, upper middle back area, shoulder blade area. Let your butt set down. Want it to be comfortable to the head and the neck. So you're going to let your head fall back, arms open wide, and then just get there and make sure it feels comfortable enough. And then once you're there for a moment, just let everything find a little softness. Soft jaw. Mouth is together, jaw is soft, breath is coming in and out through the nose. If it feels comfortable enough, we're going to keep this gentle back bend position and give a little hug. So you're going to close your arms around your body, one up, one down, give yourself a little squeeze, take a breath in, squeeze. On your next inhale, open your arms out nice and wide. And then the next time you're ready for it, crisscross your arms, but now switch the one on top, one on bottom. Give yourself a little squeeze, breathe into the squeeze of your arms. On your next inhale, open your arms out nice and wide. And then when you're ready, come back in for that little hug, maybe adjusting where your arms land, crisscross, give a little squeeze with your arms, take a nice big breath. On your next inhale, open out your arms. And then when you're ready, you're going to come back in, maybe switch across in your arms and switch the position so that you're just finding a new spot to give yourself a hug, and then squeeze into those arms and breathe into the squeeze. And then on your next inhale, open your arms out nice and wide, and then just be soft here for a moment. Let your heart be expansive. Your chest is nice and open. There's a nice openness into the armpits and elbows and hands. Let your fingers be a little bit soft, and go for 2 more cycles of breath. All right, now we're going to scoop the hands and do just a little bitty curl. So you're going to scoop your hands like you're trying to bring them into your thighs, and then press or scoop the abdominal muscles. So when we scoop, we go down and a little bit up with that scoop, and then inhale, fall back over the ball, let your arms open into a snow angel pattern. And then as you exhale, scoop the abdominal wall. Reach your hands towards your thighs. Hold there just for a moment. Feel that firmness in your center. And then on your next inhalation, snow angel the arms gently over the ball. And then one last time, scoop, push the belly button towards the spine, up towards the ribs. Hold in that top position. Feel that firmness in your center. And then on your inhale, soften. And then we're just going to roll off one side. So you're just going to roll off that ball, get it out from underneath you, and then come onto your back and take a moment to notice, just to notice the benefits of the back bend, the benefits of the core work. And then we're going to go for the toe tuck supine twist. So let your right leg go just a little bit long. Take your left toes and tuck them underneath the pit of your right knee. Once you've got your toes tucked, let the knees fall over to the right. Shoulders stay anchored onto the ground. Turn your head to the left and then hang out there for a moment. Notice your breath. Before we release this twist, take your left hand and stretch it up alongside your ear, and then just think big, yawning, reaching stretch from your fingertips to the side of your hip. Take a nice, big, yawning, reaching breath. And then as you exhale, soften, roll onto your back, and we're going to switch the work to the other side. So left leg is going to go a little bit long. Right toes are going to tuck underneath the pit of your left knee. Right knee rolls over to the left. Arms or shoulders stay anchored down to the ground, arms nice and wide, head turns in the opposite direction of your knee. Before we release the twist on this side, take your right arm, stretch it up alongside your ear. Think big good morning stretch from your fingertips to the side of your hip. Take a nice big breath. And then as you exhale, soften, rolling onto your back. Keep your right leg in a bent knee position. Then just hop your left leg right over into a figure 4, and then lift that figure 4 up, thread your hands through, and go for that middle space. Not too close, not too far. Find that mid position, and then just let everything be soft for a moment. When you're ready, slow release, uncross to recross, bring the right leg over the left, pick it up, and then find that middle space, not too close, not too far. And then once you found that mid space, soften into it just a touch. Take one more breath. And then when you're ready, slow release, uncross your legs. And my suggest for our finish is that we put our legs in constructive rest and we use the ball on left side, stomach side. And we just kind of compress slightly over to the right and let the weight of our hands rest on the ball. So if that feels like a cool way to finish, go there. And if it feels like you'd just rather take a more neutral position, shoot for what feels really nice to you. When we do this left side, stomach side, the purpose of the work is to engage a little softening into the sympathetic nervous system. We've got our vagus nerve that runs from the base of our skull, wanders around the neck and the throat, to the lungs and the heart, down into the digestive organs. And our stomach side has sort of just this like quick and direct conversation with our nervous system and our brain. So when we do this left side, stomach side, it's just about kind of soothing the nervous system just a little bit. So allow that softness to come into your abdomen. Let the weight of your hands rest on the ball. Let your eyes close down and just allow your breath to come in at a soft and gentle pace. You always have the option to stay in your Shavasana as long as you like. If you kept the ball on your abdomen, if it feels good, you're going to start to just follow that digestive tract circle again. So you're going to go up on the right, over and across to the left, and then down on the left. And it can be a really nice light touch at this point. We've worked the digestion just enough. So sometimes it's nice to come back in with that sort of soothing touch. So maybe you lighten up the pressure on the ball, but still allow it to follow that digestive tract and go for maybe 1 or 2 more circles or half circles, however you're thinking about that movement. More like an upside down U. All right. And then once you've done just enough, maybe take that ball and just set it off to the side. Let your arms open out into that anatomical position just for a moment. Twinkle your fingers, wiggle your toes. Hopefully you still got your spacer on. So it's giving that just good wide spread to the toes and a bit of space for the plantar fascia to just wiggle themselves awake. And then stretch your legs nice and long, stretch your arms up above your head, point your toes, spread your fingers, take that nice, big, yawning, reaching stretch. And then once you've yawned and reached and stretched just enough, slowly, slowly, slowly bring yourself up to a comfortable seat. Now you can sit on the Pilates ball. It can be a nice way to get a little bit of that breath feedback down into that pelvic floor area. So if you like sitting on the ball, put the ball underneath your bum. And then once you've got a nice sturdy seat, bring your hands into a position where the palms are facing up and one hand is just stacked on top of the other. And then allow your feet and your toes a moment to soften. Allow your hands a moment to feel into the warmth connected to each other. Take a nice generous breath, fill your rib cage up. Breathing in love and gratitude for yourself, for your mind, for your body, for the times that you show up on your mat, even when it's not easy. And then take one more breath of love and gratitude that you can carry with you through the rest of your day to share with anyone else who might need it. And then when you feel ready, gently lift up through the top of your head, gently open your eyes. I bow to you. Happy Thursday. You guys are amazing.